Today's presenter is April D. Matthias, RN, a PhD candidate in the College of Nursing with a projected graduation date in spring-summer 2011. And here is Ms. Matthias to speak on the resurfacing debate, historical perspectives of multiple entry levels to RN practice.
Thank you, Melissa. Well, I'm delighted to share just a piece of my historical research with each of you today. Today I will discuss how I came to my dissertation research questions and methodology, as well as provide you a small slice of the data I have collected thus far. Currently, I am deep in the analysis and writing phase of my research, so I will end my presentation with a series of questions that have evolved from my data collection that I am using to guide my analysis. Many individuals outside the profession of nursing do not know that there are 3 entry-level educational pathways to become a registered nurse. The 3 educational pathways include the diploma pathway developed in 1873. This is traditionally known as the hospital nursing school and is about 3 years in length. The BSN, or Bachelor of Science in Nursing, educational pathway developed in 1916. These programs are found in the college or university setting and range from 4 to 5 years in length. The ADN, or Associate Degree Nursing pathway, developed in 1952. These programs are found in community and junior colleges and are typically 2 years in length. The graduates from each of these pathways can earn the title Registered Nurse, or RN, after successful completion of the same licensure examination. There is a lack of differentiated practice by educational preparation. Nurses from these 3 different educational pathways coexist under the same title and practice within the same role with the same functions because each of these nurses hold an RN license. I will expand on differentiated practice later in this presentation, but historically, the existence of multiple educational pathways to entry-level RN practice created a debate within the profession of nursing. Let me now share with you how I came to know this. My dissertation is historical case study research. I would like to share a little bit more about myself, not only to explain to you how and why I came to my research questions, but also as a means of self-disclosure, which is required within my research method. I was introduced to associate degree nursing when I moved to North Carolina in 1999, and I began working alongside ADN prepared nurses. A year later, I began teaching in an associate degree nursing program, and I have been an associate degree nursing educator for the past 10 years. As I became immersed in the PhD program here at ECU, I found myself caught between 2 worlds. I was caught between these 2 worlds because of the conflict and defensive nature of discussions between the ADN and BSN nurses and educators, specifically following the 2003 publication of Linda Aiken's article, Educational Levels of Hospital Nurses and Surgical Patient Mortality. The conclusion of Aiken's research illustrated in the article reads, quote, "In hospitals with higher proportions of nurses educated at the baccalaureate level or higher, surgical patients experience lower mortality and failure to rescue rates," end quote. Predictably, as a new PhD student, I began to ask many questions. Through discussions with several of my professors here at ECU, I decided to embark on an independent study in the summer of 2007 to learn for myself the history of associate degree nursing, to learn why it was developed and what the intended role of the associate degree nurse was supposed to be. And this is what I've learned. Associate degree nursing was developed for many reasons. Following World War II, the changes in healthcare, along with an increase in the number and complexity of nursing functions, created a hospital nursing shortage and therefore a demand for more nurses. There were several reports on nursing and nursing education between 1923 and 1948. In 1923, nursing and nursing education in the United States, commonly referred to as the Goldmark Report. 1934, the Nursing Schools Today and Tomorrow, final report of the Committee on the Grading of Nursing Schools. The 1948 Nursing for the Future, otherwise known as the Brown Report. and the 1948 A Program for the Nursing Profession by Eli Ginsberg. Each of these reports suggested disorder within nursing education and offered solutions. The solutions offered included distinction of roles between the graduates of the already existing different educational pathways, which at that time was the diploma pathway and the BSN pathway. Movement of RN education to the university and college setting and away from the traditional hospital diploma schools. And the last report, A Program of the Nursing Profession by Eli Ginsberg, predicted that the shortage appeared unrecoverable without two tiers of nurses, a professional and technical role. The researcher who developed the ADN education program, Mildred Montag, shared the beliefs of differentiation of nurses' roles and the need to develop a new technical role. The late Mildred Montag, she passed away in 2004. Her research provided the foundation for the associate degree nursing education. Her 1951 research, titled Education for Nursing Technicians, proposed the development of the third educational pathway leading to RN licensure. Here's what she proposed. She proposed a new worker in nursing, the technical nurse. The technical nurse preparation would be a 2-year program within the junior community college. The curriculum would consist of both general courses and technical or nursing courses, and the graduates would receive an associate degree and qualify to test for RN licensure. The associate degree would be a terminal degree to practice technical nursing. Montag's research was based on the assumption that nursing functions could be viewed on a continuum, differentiating the practice of nursing into 3 distinct roles with specified functions. Montag's practice model continuum differentiated nursing practice into 3 roles with corresponding range of function. The 3 roles included the nurse aide, who would be trained on the job and would not need to complete a training course distinct from the employing agency. The technical nurse would earn the associate degree in nursing, and the professional nurse would be the BSN prepared nurse. The technical functions that fell in the center of the continuum are more limited in scope and restricted to largely repetitive and routine situations that require skilled techniques and exercise of judgment. The technical nurse carried out these functions under the supervision of a physician or a professional BSN nurse. Although Montag did not use the exact term differentiated practice, her model and explanation of it is comparable to today's definition of differentiated practice as defined by Boston in 1990. Differentiated nursing practice has been defined as the structuring of roles and functions of the RN by education, experience, and competence. Montag differentiated nursing functions into assisting, technical, and professional roles and designated an educational preparation that would prepare each role. Montag believed that with differentiation, nursing would ensure better care for patients and increase the job satisfaction of each worker or nurse. Now, Montag's research was piloted at 7 colleges across the United States. The programs were considered successful because the graduates did pass the RN licensure exam, and head nurses at this time rated the graduates as good as or better than their counterparts from other nursing programs. However, Montag's practice model was denied. Employers hired graduates into positions with the same nursing role and functions as the diploma and BSN graduates. RN licensure, rather than the educational preparation of the nurse, determined the role of the ADN graduate in practice. The role of the technical nurse dissolved as the graduates entered practice. Here is a good time to point out a challenge of Montag's practice model continuum. The diploma-prepared nurse, who at that time held the majority of RN licenses, was not represented on her continuum. If the associate degree nurse was to replace the diploma nurse, this change or transition was not addressed in her research or in the pilot project. Numerous ADN programs opened throughout the United States, sending a large population of ADN-prepared nurses into practice. Undefined roles for the RN of what were then 3 different educational pathways resulted in conflict and a debate within the profession of nursing. Numerous articles concerning the role and practice of the ADN-prepared nurse in the literature of the 1960s and 1970s, the position papers of the American Nurses Association and the National League for Nursing, and many studies on differentiated practice in the nursing literature in the 1990s serve as historical evidence of the confusion and division that challenged the nursing profession after the development of the ADN educational pathway. This debate continues to resurface over the years. I would like to take a few minutes to share more regarding this historical evidence. The nursing literature in the 1960s and 1970s demonstrates how nurse leaders pleaded for differentiation of nursing role and functions between diploma, ADN, and BSN RNs. Martha Rogers is one nurse leader who adamantly encouraged differentiated practice by educational preparation to not only enhance the profession of nursing, but also to enhance the welfare of society. Rogers believed that without differentiation, the public would have little cognizance of the services it seeks or receives. Rogers defined lack of differentiated nursing practice by educational preparation as monuments of conflict and confusion. In 1961, many years ago, she labeled the refusal to differentiate nursing practice as one of the most significant problems facing nurses. In 1965, the American Nurses Association and the National League for Nursing both issued position papers that encouraged differentiated practice and classification of the roles as technical and professional, delineating the educational programs to prepare each role or the call to action to do so. Due to a strong opposition from practicing nurses and nurse leaders of diploma and ADN education, neither position was maintained. Debate continued with attempts to differentiate nursing practice, agree on titling, and appease both nursing education and nursing service. In 1978, the ANA once again published a position paper very similar to the 1965 paper, proposing differentiated practice, yet put a timeline on the resolutions proposed and added support for career mobility between the educational pathways. The terminology professional was retained in this paper, but the term technical was deleted and was left untitled, termed other category. The resolutions did not meet the deadlines proposed. By 1982, the ANA and the NLN were in official agreement that the baccalaureate degree, the BSN, should be minimal preparation for, quote, professional nursing practice. And the NLN supported all educational programs in nursing, for it was social reality, due to the large number of ADN programs. Both organizations today still support all educational pathways in nursing. There were numerous studies noted in the literature between 1990 and 1999 concerning differentiation of entry-level RN practice, and these articles reported positive and beneficial outcomes, such as increased patient satisfaction, efficient and effective utilization of scarce nursing resources, empowered decision-making, and preparation of graduates for a more specified role. No studies reported negative consequences to the differentiation of entry-level RNs. Only 2 studies in the 1990s reported barriers to the implementation of differentiated practice. They were lack of appreciation and value for the other educationally prepared nurses, ignorance, lack of current differentiated compensation, insufficient supply of BSN nurses, and a decrease in applicants to nursing programs. While beneficial evidence supporting differentiated practice has existed in the literature, the differentiation between entry-level RNs has not been widely implemented. Barriers rather than negative consequences may be the reason for this hesitance to implement differentiated practice. The most recent resurfacing of the debate occurred with the BSN and 10 legislative proposals. In 2007, the New York and New Jersey American Nursing Association submitted legislative proposals that are commonly referred to as the BSN and 10. These proposals mandate advancement of a diploma and associate degree nurses education to the baccalaureate degree in nursing undergraduate level within 10 years of obtaining initial RN licensure. Submission of the proposals demonstrates the state's commitment to advance the education of nurses and deliver the best quality care to patients. These proposals do extend support to the continuation of diploma and ADN education as a means to enter the profession. However, the proposals could change the historical context of ADN education and practice. The intersection of ADN history and the BSN and 10 is very complex because it involves what the ADN nurse was intended to be, what the ADN nurse actually became, and what the proposals want the ADN nurse to become. Let's look at some of the similarities and differences. Associate degree in nursing was to be a terminal degree to practice as an RN, and over the years it has been, yet the BSN and 10 wants to change this. If the ADN nurse does not earn a BSN degree within 10 years of obtaining initial licensure, RN licensure will be denied. Montag's research differentiated nursing practice into technical and professional roles. The BSN and 10's suggestion of temporary licensure of the ADN nurse prior to obtaining a BSN suggests a difference between the ADN and BSN nurse in practice. Montag's research and the BSN and 10 recognize a difference between the ADN and the BSN nurse's practice. But a question about the difference remains, for although Montag defined the role and functions of the ADN technical nurse, the BSN and 10 does not provide a defined role with correlating functions for the ADN nurse. These contradictions between what has been, what should have been, and what will come demonstrates the debate in nursing regarding entry level to RN practice. There are three main elements to the debate since the development of the ADN educational pathway and the ADN nurse. What is the role and correlating functions of the entry-level RN? Which educational pathway should prepare the entry-level RN? And what is the professional identity of the entry-level RN? Based on what I have shared thus far, it seems as if associate degree nursing created the debate and conflict within the profession of nursing. But is this true? Through extensive literature reviews conducted for my other coursework, and through studying nursing history within elective courses, I discovered that it is not true. Associate degree nursing did not create the debate. The elements of the debate have existed for greater than a century since the inception of the Nightingale model for training nurses in 1873. Some of the evidence I have provided to you already, the reports on nursing in the early 20th century, before the development of the ADN pathway, illustrate the very elements of the debate. The debate regarding role and functions, educational pathway, and professional identity of the entry-level RN is an historical debate. The development of the ADN educational pathway and subsequent ADN prepared nurse was just one attempt to resolve the debate through differentiating nursing practice, defining the educational pathway of each role, and defining the BSN prepared nurse as the professional nurse. The development of the ADN educational pathway certainly did not create nor resolve the debate, although it did become the one event in nursing's history to cause the largest and loudest resurfacing of the debate. As I recognize that the debate existed for more than a century before associate degree nursing, I also realized that I needed to study the history to fully understand the debate of today. I then began to develop my historical research study. Here is the framework of my study. My preliminary historical review suggests 3 events that are significant to the historical debate. The development of the diploma pathway at the Bellevue Training School for Nurses in New York in 1873. The development of the BSN pathway at the School of Nursing and Health within the College of Medicine at the University of Cincinnati in Ohio in 1916. And the development of the ADN pathway, and the first piloted school was Orange County Community College in New York in 1952. Using these 3 educational pathway developments, I am conducting historical case study research. Now, this is my drawing, and I will explain it in just a moment. My previous dissertation chair suggested that I illustrate my thoughts within a drawing so that I could literally see the formation of my research study and focus my research questions. I wanted to share this drawing with you, not because I'm a good artist, but because of its importance to not only the formation of my research study, but to its continuance, because this drawing stays in front of my desk when I write, and it keeps me focused on my original questions, because it's very easy to get distracted. So here's my picture. Let me explain to you. This is the nursing education bridge, and down below the bridge is Roll Confusion Valley. Each car represents one of the educational pathways, and notice the stripes on the car tell you how many years is each pathway. And so my question is, can nursing education support all 3 cars? You'll notice that they had to cross through some barriers to get onto the bridge. And so I want to know who or what tried to stop the cars from entering the bridge. What were the barriers, and who or what opened the final gate? You'll notice the bridge is sagging quite a bit. And then I ask, what is in the cargo trunk of the cars? What is each car bringing to RN City? Because that's where they're going, hence the sign. And who's driving the cars? And where are they going to go when they get there? Where are they going to park? And what are they going to contribute to the RN? So that's my drawing. So from that drawing, I came up with 4 research questions. The first 2 focus on the developments, the resurfacing historical debate, and the relationship between the developments and the debate. Number 1, what is the history of the resurfacing historical debate regarding the role and functions, the educational pathway, and the professional identity of the entry-level RN in 1873, 1916, and 1952? Number 2, what is the history of the decision to develop the diploma, BSN, and educational pathways? Number 3 and number 4 are significant to illustrate the relevancy of this historical research to the nursing profession today and the current BSN and 10 debate. Number 3, does the historical study of the entry-level RN educational pathway developments and their relationship to the historical debate reframe Montag's nursing functions continuum practice model? And if so, how? And what impact might the evidence from this historical study have on the decision regarding the present BSN and 10 legislative proposals? Because of the complex socio-cultural political context surrounding the developments and the debate, I am using several theories to guide my historical study. Role theory guides my study of the social context. King's interacting systems framework guides my study of the cultural context. And feminist theory guides my study of the political context. My preliminary historical review included archival retrieval of primary sources on the development of the Bellevue Training School for Nurses in New York at the location noted on the slide. It was here at this archive that I learned of several primary documents, specifically reports and meeting minutes, that are said to be housed at the Bellevue Hospital itself. The documents at the Bellevue Hospital are known to be stored in boxes with lots of yellow dust on top I'm told, and uncatalogued. They are also unavailable to the general public. For 2 years, I sent correspondence to the public relations officer at Bellevue requesting access to the records. Ultimately, access has been denied. I have since completed archival retrieval of primary sources on the development of the first BSN program at the University of Cincinnati in Ohio at the noted locations on 2 separate occasions. The Wedbush Center, which is the last one on the list there, is a relatively new, beautiful one-room museum within the College of Nursing at the University of Cincinnati. The artifacts are cared for by a group of alumni and select faculty. I had the privilege of being introduced to one of these individuals. She's a 1946 BSN graduate of the University of Cincinnati, and her name is Mrs. Betty Michaels. She not only opened her home to me on my second visit to Cincinnati, but she also provided me full access to all the files in the closet of the Wedbush Center. Unfortunately, the whereabouts of the nursing school's records prior to its move to the university are unknown by every single person I asked in the city of Cincinnati, at the university and the city of Cincinnati archives. I have just recently received primary sources from the Teachers College archives at Columbia University to specifically study the first ADN program piloted at Orange County Community College in New York. This case study's archival retrieval has not been without its own challenges. The records needed are not available for review at the archive by anyone that's unaffiliated with the university, and I'm not. I could only request copies of the documents that I was able to learn about through extensive literature reviews, literature searches, and through library search engines that I did not have full access to either. This was difficult because the specific collection, I am told, is not well organized or cataloged. That's per the librarian that I worked with. This also created a financial burden at $1 per page. I received more than 1,500 pages, a steep price for rigor. Because primary sources of my data collection will increase the rigor of my study, so therefore I believe it was well worth it. I have already shared with you much of what I have collected thus far on the ADN case study, but let me begin to close by sharing with you some of the highlights of the other 2 case studies. Now, I just shared with you some of the documents I could not get to, but I also was able to get my hands and eyes on many, many documents. And so this is what I'll share with you today. The first educational pathway case study was the diploma pathway. It's established in 1873 at the Bellevue Training School for Nurses in New York. With mass movement into the cities, filth and disease became new concerns for the high society men and women. A group of public-minded women formed a subcommittee of the state charities aid, and it was led by Louisa Schuyler. This subcommittee was named the Local Visiting Association of Bellevue Hospital, and they set out to investigate the conditions of the city hospital. This group of women toured Bellevue repeatedly for several months and found deplorable conditions. Here are just a few of the things that they saw. Infestation with rats. Large pots were used both for brewing coffee in the morning for the patients as well as laundering linens in the afternoon. Patients were left unattended or attended by less than desirable criminals that were serving their time by working in the hospital. After summarizing their observations into reports, it was decided the best plan of action would be to open their own training school for nurses to have a sufficient supply of women to provide adequate care to the patients of the hospital. The local visiting association proposed establishment of a training school to mirror the St. Thomas's Hospital Training School in London that was instituted by Florence Nightingale. At this time, they had minimal support from the commissioners of the State Charities Aid and from the physicians of the hospital. But Dr. Gil Wiley went to visit London to study the St. Thomas school by Florence Nightingale and to also meet Florence Nightingale himself. Unfortunately, he was unable to meet with her, but she sent him a letter, and this letter outlined her suggestions for a proper training school for nurses, and I actually got to see the original letter. Upon his return from London, the local visiting association gained support and funds were quickly collected. The Bellevue Hospital decided to adopt the Nightingale model for training nurses, and the letter sent to Dr. Wiley from Florence Nightingale was used as a strict guide to develop and operate the training school. There were also 2 other hospitals that opened a Nightingale model training school the same year as Bellevue, just months after. The Connecticut State Hospital in New Haven and the Massachusetts General Hospital of Boston. The opening of these 2 schools within a very short time frame demonstrates the greater movement that was occurring within the developing nursing profession, although my case study research is focused only on Bellevue. Let me stop for a quick moment and ask and answer a question that you may be thinking. This is a good time for a quick fact check. You may be wondering, did professional nursing already exist in America at this time? The answer is both yes and no. Let me explain. Yes, in the mid-19th century, professional nursing has been identified by nurse historians as that practiced by the French Daughters of Charity, and then in the 19th century as that practiced by the American Sisters of Charity. These Catholic nurses received their education through vocational training. But no, a similar training program did not exist for Protestant women in America to the extent that it did for the Catholic Daughters and Sisters of Charity during this time period. There were numerous training programs created and maintained by and for specific hospitals. Yet as described, the nursing care provided by many nurses, I use that term loosely, in the majority of the secularized American-owned and operated hospitals was desperate. In 1873, training schools began a differentiation. The Nightingale model schools created the trained nurse. This trained nurse was different than those that were trained by other schools and were different than other lay caregivers. Bellevue developed its nursing school to train nurses not only to care for the sick, but also to teach future nursing students and supervise schools of nursing. The historical debate, as identified earlier, did occur with this new 1873 educational pathway development. These questions illustrate the debate. What is the trained nurse? What were the defining role and functions of this nurse in comparison to the already existing nurses in 1873? Which school or type of school can best prepare the trained nurse? Which educational pathway? Is this new trained nurse the professional nurse in America? Will the role and functions and educational pathway of the trained nurse now define the professional nurse? Further evidence of this debate was found in the archives. A 2-year, 10-letter correspondence between key individuals of the Bellevue Training School for Nurses and the training school at New England Hospital for Women and Children in Boston. Correspondence began when Dr. Mary Hobart of the New England Hospital asked Louisa Schuyler, then an honorary member of Bellevue, to relinquish recognition as the first training school for nurses, because New England's hospital training school began a year earlier in 1872. The women respectfully wrote back and forth presenting their case to be named the first. The basis of Bellevue's argument lies in the standards or guidelines that Nightingale personally provided to Bellevue for operation of the school, which New England lacked in full. One interesting argument presented by Dr. Hobart of New England is the fact that Linda Richards received her nurse training from the New England Hospital. Linda Richards became an instructor, per se, and nursing supervisor at Bellevue Hospital shortly after she finished her training program at New England. But more importantly, Linda Richards holds the title as the first trained nurse in America. Schuyler of Bellevue replied with the fact that Miss Richards, of course, received additional training at Bellevue as she was prepared for her teaching and supervisory role, and therefore both Bellevue and Miss Richards can both retain their first title. The women agreed to disagree by the 10th letter, and Bellevue predominantly retains the title as the first training school in America. The Bellevue Training School for Nurses, the first hospital training school following the Nightingale model, ultimately became the diploma hospital-based programs of the 20th century. The second educational pathway development was the BSN pathway, established in 1916 at the School for Nursing and Health at the College of Medicine and the University of Cincinnati. Parallel to the women's movement of the mid-19th and 20th century, nurses became organized through development of the first nursing organization, the American Society of Superintendents of Training Schools for Nurses, in 1893. Nurse leaders through this organization advocated for nursing's right for professional autonomy. The nurse leaders fought to gain control of the nursing students in the school's curricula and away from the paternalistic control of the hospital administrators. Along with the nurse leaders' push to move nursing education away from the hospital control and to gain professional autonomy, the education of other professionals, such as clergy, physicians, and teachers, occurred in the university setting. With the combination of the women's suffrage movement and organized nursing organization fighting for professional autonomy and movement of professional education to the university, nursing education also migrated to the university setting, although incrementally. The first move was the availability of advanced courses in a college or university for nurse graduates or senior nursing students, those who desired to specialize their training to prepare for teaching or administrative roles within nursing schools, or who desired to be public health nurses enrolled in these courses. A literature review shows that the Teachers College of Columbia University was the first American university to offer such classes for nurses in 1899. In 1909, the University of Minnesota, often noted to be the first university-based nursing school, assumed administrative control of an already existing hospital-based training program in order to, quote, establish a school of nursing as an integral part of the university system, end quote. Less than a decade later, a combined liberal arts and professional program that provided both a university education and hospital training was established. The graduates of these programs earned a professional diploma for the hospital training they completed and a college degree for the liberal arts general college courses that they took. The University of Cincinnati is noted as one of the first schools in 1916 to offer a 5-year combined liberal arts and professional program, leading to a Bachelor of Science college degree and a professional nurse training diploma. This is a dual BS diploma program. This combined program is defined for this research as the curricula that became the BSN pathway. It is historically important to point out that these university programs did not replace the diploma programs. The university programs became a second pathway for those wanting to become a nurse. The dual BS diploma degree took 2 years to be approved. On June 2, 1914, the Director of Public Safety proposed a secure cooperation between the university and hospital, requesting movement of the hospital training school to the University of Cincinnati in the interest of efficiency and economy. The proposal was investigated by the president of the university, who visited other universities that had administrative control of the schools of nursing. Less than 2 months later, he agreed to the proposal with a condition, the condition that the hospital continue to finance the school. The proposal was then given to a select committee for consideration. Approximately 7 months later, the committee dissolved and the proposal was not accepted. Supporting papers for the Board of Trustee meeting minutes illustrate the dual BS diploma curriculum, the plan of study. Yet the board minutes or the proposal did not address or suggest such a drastic change to the curriculum. Also interesting is the two schools that were investigated by the president, the University of Minnesota and the University of Indiana, did not have the dual degree program at that time. And the University of Minnesota, which took over administrative control of its hospital training school in 1909, still did not financially support the school in 1914 or for decades to come. Either one of these may be the undocumented reason for the denial of the proposal. On June 29, 1916, the original proposal and the dual BS diploma curriculum was approved. So what happened between 1914 and 1916? In 1914, a new immaculate 850-bed modern hospital was built and named the Cincinnati General Hospital. The new hospital provided a visual representation of the vision and concerns of the medical community and public officials of Cincinnati. The health and welfare of the Cincinnati citizens and the growth of the medical school urged the development of a modern hospital facility. It provided a glimpse of a dream of a great Cincinnati medical center. Reorganization of the School of Nursing seemed advisable to meet the changes of the hospital and realization of the vision of a great medical center. The first major occurred with the hiring of Laura Logan. She became the superintendent of the School of Nursing in September of 1914. Logan's commitment to public health held deep roots. Logan viewed the role of institutions that educate and train nurses to be, quote, subserving not merely the immediate need of a hospital, but responsible for preparation of professional members of society, concerned with the health and welfare of a community, end quote. Logan's desire to prepare graduates for a broader role beyond the hospital nursing and for the role of public health nurse was outwardly publicized and evident in the changes she implemented. Although not officially employed by the hospital or university, her name actually appeared in some of the documents months prior to her hire date. Logan was hired with the assurance that the hospital School of Nursing would become part of the university. Although it is not certain whether she originated the vision of the proposal, it is certain that Laura Logan embraced the vision. She did not sit back and wait for the move to the university to happen. She began to press forward with the vision. Logan held a new philosophy for the hospital's nursing school, that of cooperative education, that she defined as, quote, an exercise in integration, the synthesis of theory with experience, and personal development with intellectual growth, end quote. Logan borrowed the philosophy of cooperative education from the University of Cincinnati College of Engineering professor Herman Schneider, who initiated such a program in 1906 with engineering students. The cooperative education system was based on a major idea, that of balanced training, alternating theory in the classroom and practice in the laboratory or workplace. Many changes took place between 1914 and 1916 that embraced the cooperative education philosophy and that also embrace the ability to prepare students or graduates for the public health nurse role. The first change is that of care and maintenance of students. The students were afforded greater uniform and textbook allowances, extended vacation time, and the hospital cared for the student during illness. Along with such privileges, professional accountability and responsibility was expected. It was noted in a Cincinnati newspaper that students were dismissed and reduced to the level of probationer for unprofessional behavior, both on and off duty. Secondly, there were significant changes made to the curriculum plan of study. Credit hours were assigned to classroom and practice courses. The University of Cincinnati Medical College professors provided lectures and demonstrations. The sociology course that she instituted was offered on the campus of the University of Cincinnati, and several courses were added that covered broader concepts of nursing, such as psychology, the history of nursing, household economy, and hygiene and sanitation. Logan also gained supervision of the nursing department within the tuberculosis sanatorium, with the forward intention to develop an optional course in tuberculosis nursing. And last but not least, in an effort to succeed in standardization and perfection of nursing procedures conducted by both students and nursing staff of the new hospital, Logan required both nursing staff and students to attend demonstrations held twice a week for 4 months. The city also purchased a life-size doll, as we refer to as mannequins, in 1915 to assist students to perfect skills and techniques. All of these changes fully supported the hospital school's move to the university and set the stage for the expanded dual BS diploma program designed to prepare the graduate for the public health nurse role. The historical debate, as identified earlier, did occur with this new educational pathway development as well. These questions illustrate the debate. What is the role and functions of the public health nurse? The role in which Logan was determined to prepare her graduates for. Which program or courses best prepare the student for the public health role? And is this graduate nurse with an expanded education the new professional nurse? The reports on nursing between 1923 and 1948 that I shared with you earlier, as well as the dialogue in the nursing literature, supported the move of professional nursing education to the university. This move would support the nurse leaders' desire for professional autonomy and their desire to move away from the paternalistic control of the hospitals. To summarize, I'd like to review the 3 case studies together on one slide through the lens of the historical debate. Each new educational pathway development introduced a new type or kind of nurse. The diploma pathway introduced the trained nurse, the BSN pathway the public health nurse straight out of nursing school, and the ADN pathway the technical nurse. Each new pathway development outlined the program type and courses necessary to develop each nurse. The diploma, the Nightingale model, the BSN, the dual BS diploma degree, and the ADN, the combined general and technical courses within a community college. So which one should be entry level? Which one is the professional nurse? These questions remain unanswered, and this is evident even today with the looming BSN and 10 legislative proposals and its opposition. As I continue my data collection and writing, here's a few of the questions that travel my thoughts. Should any one of the educational pathways or nurse roles have replaced another? Do we simply need to redefine or refine Montag's practice model? Has nursing really gained professional autonomy, or do the service agencies still determine the curriculum and practice of the RN? Does the very nature of nursing, selfless service, handicap the profession's need to attend to itself? And were any one of the pathway development decisions made with the future in mind, or did they only consider the present needs of that particular time period? Does nursing need to choose one entry-level educational pathway to identify itself as a profession? I'd love to hear any of your comments or questions, but first I want to thank you. I'm very grateful for this opportunity to present the research I've done thus far. Thank you for your time and attention. Thank you.
Associate's educator, like, for that degree, what do you think should be improved, from that program compared to like BSN? Like, what is?
I don't think there needs to be any changes to it. I think the problem is not in the education. The problem is what we do in practice. Okay. Through my research, I've really embraced the differentiated practice, and some states and some hospitals are performing models that are very similar to that, and they are successful. One of the articles that I had read from the 60s and 70s said that nurses are performing outside of their scope, which not only can cause safety issues, but also can cause internal feelings of not feeling adequate or prepared. And so that was one of the things that Montag stressed, was that if we had this hierarchy of nursing practice, then every nurse could perform to her best within her range of functions, and then everybody would feel successful. And I'm leaning that way, but I'm not decided yet. Oh no, here we go.
That was a great presentation, April.
Thank you.
Thanks. I'd like to hear a little bit more about the historical actors who were most vocal in the debates. So, for example, who did, I think Laura Logan, who did she find to be her sort of most vocal opposition, and why? And what kind of, or in
Well,
1950?
at that particular time period, there wasn't opposition to the BSN, and there was little, the debate was more in education rather than practice, because when the BSN nurses graduated, they did have charge nurse roles, and so there was a little bit more differentiation between them in most practice settings. The vocalization is coming from nurse educators pretty much throughout history.
What would you say in 1952 were some of the, who were some of the historical actors who were getting all hot and bothered about the debate?
Yes, well, McManus at the University of Columbia Teachers College, she was very vocal in nursing education, and some of the things that I did not share because I have not finished my reading, but it looks as if the ADN was supposed to replace the LPN, was supposed to overshadow, because there was a lot of debate about whether to have this licensed practical nurse at that time, and so Montag pushes forward as an EDD student and, you know, solves the problem, because there was a lot of debate within the College of Nursing where faculty would not even teach or work on the LPN curriculum because they didn't believe in it. So, but that's a whole other study. But it seems like most of the arguments and debate is between educators more than practice, because practice just does with them what they want once they graduate. I mean, quite honestly, that's what's happening.
Thank you. I enjoyed your presentation very much. You mentioned the BSN in 10 proposal. Where does that currently stand? Is that just one state? You mentioned New Jersey.
It's New Jersey and New York right now, but I spoke with one of the key individuals that pushed it forward in the state of New York, and she said that there are other states that have contacted her that are thinking about the same proposal. And right now it's with the legislatures. It's out of, they're kind of waiting, last I talked with her. Yes, ma'am. Oh.
April, you kind of alluded to one of my questions, which was about the LPN, because I wasn't sure, but I thought that the ADN kind of came in response to the LPN. But the other question, which is more contemporary, what about now the entry level at the master's level, which seems to complicate things even more? We have a program like that, and they are flourishing right now. Or is that just beyond what you can?
I did not include them in my study because they are so new, and they are entering practice before they obtain their master's degree. Am I correct in saying that? They are able to practice, they're able to get their licensure, and therefore they don't get a BSN degree. But I'm under the impression, and somebody tell me if I'm wrong, that the education they get until they can start practicing is equivalent to the BSN. Dr. Schreier shaking her head, yeah. Yeah, and so I consider them very similar to the BSN prepared because of the same setting and the same courses, although it is somewhat accelerated. And that's also why I did not include the RN to BSN either, because again, it's still a BSN when they're finished with the program.
I just wanted to give you a little bit of historical detail.
Okay.
The New York and New Jersey have been working on what they're working on since the 70s.
Mm-hmm. Right, and when I spoke with her too, she said that they went with the BSN in 10 versus just saying all entry-level BSN, because they figured that that would not go through at all, that this would give them better chance to elevate the education of nurses.
40 years worth of experience, I guess, taught them that.
Yeah. Well, one thing I've realized in nursing is that we can't agree to disagree, like Dr. Hobart and Schuyler sometimes.
I have a question. As a non-nurse in this group, are there still diploma programs?
Yes, very few, but they do exist. I think we have like 2 or 3 in the state.
This isn't a question, this is just a comment. Regarding the steep price for rigor, my understanding is, and I do some work in the history of medicine, that the history of nursing is actually very sort of hot these days, so to speak, and that there are a number of centers which have been formed, and I see countless dissertation fellowships being offered for people doing original research in the history of nursing. So should you not know of these, and should you want
I do
any
know
of
I
these?
didn't have time to apply for it.
Okay,
I'm on a timetable.
okay, understood.
Anybody else?
Well, thank you, everyone.